My experience as a resident and as a medical student at the VA greatly influenced my desire to come back and take care of their veterans here. I recognize that the care that we provide here in orthopedics, we are providing care to the veterans that they wouldn't have gotten elsewhere or wouldn't be able to get elsewhere.
The patient population is a very rewarding patient population to take care of because the impact you can have on those patients is huge.
They're a great population to work with. They're just very appreciative.
I really love working at this hospital. I think there is definitely a mission-driven approach to give outstanding care to our veterans. They've served our country and they deserve great care. So.
Hello, my name is Dr. Dang. I'm one of the orthopedic surgeons here at the San Francisco VA. My subspecialty is sports medicine, and I'm currently the section chief here at the San Francisco VA. At the San Francisco VA, one of our strengths is our tight partnership with UCSF, and it's not just within the orthopedic surgery department, but throughout all the subspecialties in medicine. We train a third of the medical students here. We train nearly a third of the residents of all the specialties here. So teaching is a big core of the San Francisco VA with regards to research within orthopedics as well as within the entire medical campus.
The VA is sort of unique. When you think about the VA, people think maybe of older veterans from Korea, Vietnam conflicts, but we think about Iraq and Afghanistan. So at the VA, we don't see pediatrics, but we will see kids in their 20s and we'll see people in their 90s.
Here in San Francisco, we take care of veterans from all of Nevada as a tertiary care center, as well as the northern half of California. So at the San Francisco VA, we currently have nearly every single subspecialty in orthopedic surgery, with the exception of pediatrics.
Any patient that comes here gets the same quality care they would get at UCSF.
We've always prided ourselves on being able to offer our veterans probably 95% of the orthopedic care that they could possibly need. That last 5% we can refer to UCSF or another academic institution if need be, but there's very little that we can't take care of ourselves. And that's largely because of the help we receive from our faculty at other sites.
We have 4 full-time attendings, myself, Dr. Alan Dang, Dr. Hubert Kim, Dr. Alfred Kuo, and Dr. Jim Tom. We have a lot of part-time attendings who are roughly half-time here, Dr. Feely, Dr. Curtis Keast, and Dr. Edwards. We have folks who come in about once every other week, Dr. Keontae Murray, and we have folks who come in on an as-needed basis like Dr. Westtrack, as well as Dr. Nico Lee.
All of our colleagues are UCSF faculty too. So you get this small town feel, but you have the expertise of San Francisco and UCSF here.
A few things that we do here that are unique to us are minimally invasive spine surgery. We offer hip arthroscopy in addition to our other orthopedic subspecialties.
So in this lab, we are studying skeletal muscle injury and regeneration. There covers a lot of scopes from rotator cuff injury to muscle atrophy to chronic pain.
So one of the central things we look at in our lab is how certain muscle progenitors, in this case fibroadipoprogenitors or FAPs, can help muscle recover. And we think that this is a complex interaction of how these cells can sense their environment, whether that's in an aged host, whether that's in an injury state, and also its inflammatory environment and how these cells respond.
I would like to say that those projects are highly relevant to our veterans' health.
Because the veterans population is aging faster than the rest of the United States, it's especially important and relevant for this patient population. So it's a unique experience to be able to do research at a VA facility. We have access both to grants that wouldn't necessarily be available to somebody outside the VA, but it also allows us to directly serve an aging and medically underserved population.
So one of our first translational programs here at the San Francisco VA in orthopedics was our 3D printing program. Over the last decade, that has translated into routine clinical care. So every single 3D print that you get at UCSF, at Mission Bay, at Children's Hospital Oakland, started from the program that started here at the VA. The most common prints we still do here at the San Francisco VA involve non-unions or malunions. Second to that is trauma, fractures, ankle fractures, wrist fractures. Over at the Mission Bay campus, most of what they do is pediatric hearts. And over at the Children's Hospital Oakland, their new center just started last year, and it's partnered with plastic surgeries.
So we have our UCSF residents rotate, and we get to work with them and teach them.
The residents get to do much more of the surgical cases than maybe they'd be able to do in other places where there's a little bit more time pressure.
I think, again, it's a great place to teach. We get to slow down a little bit. So we really have a lot of time that we can teach our residents in the OR. I think they enjoy it as well because they get to come over and have that experience where they're really running the service.
From a trainee perspective, I think this is a really valuable place to train and a valuable opportunity that we have. The expectation here is that you kind of really take on that surgeon role, and you're kind of making that transition into more of a senior role and taking on more responsibility and autonomy.
The resident clinic is awesome. You get to really focus and work on your medical decision making. It's a good opportunity to learn and to make progress in our training program.
What's great about third-year residents is that they're still in their formative time, and so we're able to really show them some of the fun nuances and ways to do surgery that they may not see in other places.
The VA has incredible views. I think anytime that I look out a window here, I am just continually amazed.